HealthLink is proudly brought to you by Moods Condom and Home Fresh.
Hello, my name is Stella and I'm your presenter for HealthLink. HealthLink TV show is health awareness weekly television program with it focus on Sustainable Development Goal 3, which ensures healthy life and promotes well-being. The main vision of this show is to address all health concerns and provide easy access to knowledge on health through education and entertainment. On HealthLink, we discuss everything on health.
So, when he opened the door, I stepped into the room and I couldn't believe my eyes. Candles everywhere. Hey. Flowers on the bed. Hey. Plain Kojo Inchi. Wow. Honestly, I was still too tired. But then he pulled it out. Huh? Moods condoms. Oh. And I told him, you should have led with that.
A real man puts her pleasure first. Moods Condoms comes in over 19 exciting variants to keep you and her in the mood. Moods Condoms, layered right. Marketed and distributed by Pharma Nova Limited.
When a woman gets pregnant, she expects to carry the pregnancy for 40 full weeks. But some of our angels arrive before their time. Since November is preterm month, we at HealthLink decided to look at preterm, how to handle or avoid it. My name is Stella. I'm your host and welcome to HealthLink TV show.
Preterm birth is when a birth occurs before the 37th week of pregnancy. According to WHO, globally, prematurity is the leading cause of death in children under the age of 5. In almost all countries across the world, preterm birth rates continues to increase. It is important that healthcare providers identify risk factors early enough to ensure timely management on the conditions and improved outcomes.
Thanks for staying with me. I have with me Nurse Mariama, and she's a pediatric nurse at Shai Osudoku District Hospital. She is here to educate us more on preterm. Nurse Mariama, you are welcome.
Thank you.
I hope your babies are well.
They're doing awesome.
That's great. So, when is birth considered to be preterm?
Preterm is any baby born alive before 37 weeks of pregnancy.
So even if it's 36 and below, it's
37 weeks of pregnancy.
37 weeks of pregnancy.
37 weeks of pregnancy, completed pregnancy. We have the extremely preterm, as babies born below 28 weeks. US, China, their cutoff point is 24 weeks. So any baby born in their country, which is 24 weeks, can't survive. But in Ghana, it's 28 weeks. Any baby born after 28 weeks of gestation is termed abortion. But we can nurse them. Some do make it, and then they become a success story for us. But when they die, it's termed as abortion. Then we have the late preterms. These are preterms between 28 to 32 weeks. That's where most of our preterms make it. They are supposed to make it with right care, equipment, and then enough collaboration between mother and then the health care workers. And then we have the moderate preterms, moderate to late preterms. These are 32 weeks to 37 weeks. Such babies don't usually even keep long at the NICU because they are very okay and can thrive as compared to those below 28 weeks.
All right. From the explanation you gave earlier, meaning a baby above 28 weeks has high chance of surviving, right?
Yes, per our setting. It has a higher rate of survival than somebody born after 28 weeks.
What are some of the risk factors that can lead to preterm birth?
Preterm can happen it can happen spontaneously. Nothing will happen, but the baby will decide to come out.
Okay.
But other things can come about resulting in the preterm.
Okay.
Let's say fetal distress. When the baby is in distress,
Okay.
it means baby is not feeling comfortable with baby wants to come out.
Okay.
Even though baby hasn't reached the 40 weeks, the mother will go into labor and then deliver such a child and term that's a preterm. And others too, fetal and abnormal or congenital abnormalities can result in the birth of a preterm. The mother will automatically go into preterm labor and then deliver a preterm baby. And then something can be sociocultural and then socioeconomical, meaning mothers are not able to go for ANC when they don't have money. And you know, teenagers, when they are pregnant, they hide it. So they lose out.
All right.
And malnutrition too can cause, if the mother doesn't take enough well-balanced diet during her pregnancy, malnutrition too can result in a preterm delivery. And then if the mother has a bad obstetric history, like antepartum hemorrhage, postpartum hemorrhage, preeclampsia, all these conditions can lead to preterm deliveries.
Well, in case we have a preterm baby and a term baby over here, how will I identify a baby to be preterm? Can you tell us some of the things or features or something that you can identify on a baby, preterm baby?
When it's a female, the minora is bigger than the majora. Ideally,
can you explain it? Because it's something
you know,
more technical.
the female vagina.
The vagina. Okay.
We have the majora is the big one that we see. And then the minora is the smaller one. But in preterms, the minora, which is supposed to be small, is bigger than the majora.
So what about the males?
The males, some of them have undescended testes. Others too, one would descend, the other one will not descend. But with time, as they grow, it will descend, or we discharge them to go and do further examination, and the surgeons will take it up from there.
I heard it's very painful, so are they able to survive it?
They do. They do.
And what other features apart from that?
They have wrinkles on their body, and then their head is a bit bigger than the rest of the body.
So are there some potential problems that preterm babies face?
Yes, they have long-term and short-term problems. I'll talk about the short-term problems that can be manageable. When we talk about, they usually have apnea. Apnea means baby can stop breathing for about 20 seconds.
Wow.
Yes, they can stop breathing and then pick up again. But others stop breathing for a very long time. That's when we start mechanical bagging with ventilation with bag and max, just to be able to get it. We bag till baby is able to breathe on his own, and we support with oxygen.
So which one is the bag and like?
That's when we use the ambo bag and max.
I think this one is your field. It's more technical. And then again.
We use the bag and a max. You choose the right size, and then you start ventilating. So baby is able, you see chest movement, and the baby is able to breathe on his own, or you get the SpO2 to be above 93%, then you can leave baby until baby is able to assume his own breathing. Then you stop, and then you support with oxygen. As baby improves, then you wean off oxygen gradually as condition, but then you wean off completely. Then another problem that they usually have is the infection. They are prone to infection. This is the main reason why we tell mothers, some don't get it, that you're not supposed to walk into NICU anyhow. We have a strict policy for both mothers and visiting relatives to comply with proper hand washing. And then the healthcare team, and then proper dusting. Every time we do dusting, you wash your hand. Ideally, every baby should have their own stethoscope and then thermometer. But it's not an ideal world, so we will not get that. But you have to clean and prepare before you use for another baby, just to prevent infection. And visitors are supposed to they have to properly gown, wear clogs, cover their hair before they enter the NICU, just to reduce the infection that will get to the babies.
Please, the gowning, what's the meaning of it?
When you enter NICU, they give you a disposable gown. You wear something on top of your dress.
Okay.
And then you wear a cap, a disposable cap.
Okay.
To reduce the infection you carried along from your house into NICU. Some people don't understand why they should gown. People don't get it why you can't walk into NICU in and out like any other wards. You can't bring. There shouldn't be 3 or 4 relatives seeing a particular baby. You walk out, another baby comes, another relative comes in. And then the ideal situation too is that a nurse should be able, one nurse to a preterm baby, because it's demanding. You do practically everything for these babies.
Okay.
And then, you know, some babies are fussy, they will cry a lot. There's nothing wrong with them, but they will cry. They need to be cuddled.
Okay.
So we need a lot of staff at the NICU to be able to hold these babies who are fast. Others who are quiet, they won't cry. You need to be able to move around the cots and the incubators to be able to tell whether there's a problem with this baby or not. And then in the ideal situation, everybody should have a monitor for the seriously ill babies. But as I said, it's not the ideal world. We have only 2 cardiac monitors. If you have 4 babies who are critically ill and you have 2 monitors, how would this nurse manage these babies? It becomes difficult. You tend to play God. But we hope people will help us get more cardiac monitors. If the bed capacity is high, at least you have enough cardiac monitors to be able to give it to these babies and be able to nurse them properly.
All right. Before we talk about the precautions, let's go for a break. When we come back, we'll continue our discussion on prematurity.
So, when he opened the door, I stepped into the room and I couldn't believe my eyes. Candles everywhere. Flowers on the bed. Plain Cocho Inchi. Honestly, I was still too tired. But then he pulled it out. Moods condoms. And I told him, you should have led with that.
A real man puts her pleasure first. Moods Condoms comes in over 19 exciting variants to keep you and her in the mood. Moods Condoms, layered right. Marketed and distributed by Pharma Nova Limited.
Welcome back. When you are choosing a condom, choose Moose, because with Moose you always play it right. Moose condoms are available in all pharmacies. Next, Mariama. So I want you to talk about some of the long-term problems that most preterm babies face.
They have hearing challenges or problems. It could be mild, severe, and then moderate. But with continuous follow-up, these problems can be identified and a needed treatment given as early as possible. When problems are identified early, it saves a lot of stress on both the health worker and then the mothers as well. And they can also have retinopathy, blindness. So when they come for follow-up, all these things, they go through, during follow-up, they go through a series of assessments.
Okay.
And they'll be able to identify whether this baby has a eye problem, which can be treated, or when it can be treated, what are the things the mothers can do to make it better. And then sometimes too, they have feeding difficulties.
Okay.
And then they have during the feeding difficulties, that's when they are taught how to do proper breastfeeding so that babies don't aspirate. And especially mothers who are doing cap and feed. You know, based on discharge, some babies can do either breastfeeding alone or they do cap and feeding when they are discharged home. So we don't teach mother proper breastfeeding techniques and then how to give the cap bottle feeding. Babies aspirate and then they come back with complication, pneumonia, and then aspirations as well, and sometimes we lose them. And then another challenge is learning difficulties. Some preterms have learning difficulties.
Right.
So through the assessment, as I said earlier, during follow-ups, they can be identified and then needed direction or teachings given to the mothers. So that instead of you making sure your child is able to recite 1, 2, 3, you can't compare such a child with somebody who is not a preterm. We educate the mothers to understand that my baby will take a while for him to grasp what is being taught in school as compared to somebody who is not a preterm.
Is there any way that you can reduce or we can reduce preterm births in mothers?
Yes. Continuous education at the ANC.
Right.
Some mothers don't come for ANC at all.
Okay.
They just come and deliver. Or it's only when they are in labor before they come to the hospital. You take their ANC card, the day they are supposed to come, the first day, they come and take the booking stage, they come for the book, and that's when they won't come. Family support is very, very important in preterm.
Right.
Without their support, mothers do not, babies don't thrive well because mothers are always sad. When they are sad, they don't get enough breast milk to give babies, and the babies don't thrive well, and then we tend to stay longer than those whose husbands are very supportive. Family members come and visit, and then there's monetary aspect to when they are asked to buy drugs. If the money is there, they buy. The baby is doing well, but those that don't have the support, and then there's no money, the mothers are always sad. Even some of the nurses and doctors have to go around to other wards and then get money to buy drugs for these mothers and food as well for the baby to be able to make it, because after putting on a lot on this baby, we don't want to lose the baby at the end of the day.
What are some of the misconceptions about preterm birth?
Some mothers think they've done something bad to God. That's why they gave birth to a preterm. And some too say maybe their mother somewhere is causing them to have preterm deliveries. I just think what a family member has done in the past is hunting them. We try to explain to them on the first day of admission. That's what we try to do. If mothers and the staff don't come into APA, we don't seem to get better results. It's a 50-50 work. Mother brings 50, the health workers bring 50. Then we're able to achieve the 100% that we need. So, and then some too, the pastor will tell you that you've offended God. That's why you developed this. In some situations, husband too suspects that their wife slept with somebody. That's why they had preterm deliveries. One made a comment that in my house we don't give birth to such babies. And he never stepped at the NICU again.
What happened to the baby?
Baby survived and went home.
Wow.
The mother kept crying the first few weeks on admission, and then mothers who have been at the NICU for a very long time, they come for follow-ups. So we introduce them to the new mothers because they understand themselves better. So they talk to these mothers and they're able to pick up. Baby was discharged. Later, the husband came to apologize and they all moved on.
I've even heard that some of the babies are from deities and other things.
Yes.
And how, like, have you heard such stories before?
One of our success story, baby Apedo.
Okay.
That's Gloria. She never wanted to come to see the baby.
Wow.
She would stand behind the NICU and peep through the door and look at the baby in the incubator.
Okay.
It took staff encouragement. The doctor spoke to her before the mother was able to even hold baby and breastfeed.
But then what was she thinking about the baby? Did she pour out her problems concerning the whole situation?
Yes, she said she didn't know whether the baby will suffer because the baby was tiny. She didn't know how to hold the baby. But with time, she fell in love with the baby, and then she picked up, and then baby survived, and then they were discharged.
That's great.
They spent 60 days on admission.
Wow,
We started calling her school prefect. She was teaching other mothers how to cope. When you come and you cry, we refer you to her, and then she talks to you, and then we all move as a family.
Wow, that's nice. Now that you've mentioned Gloria, viewers, let's hear the success story of Gloria. I'm currently at the neonatal sick bay and I'm with Gloria, who had a preterm baby. So let's listen to her success story. Gloria, it's saying. Now, I want to say. So, what's me saying now? No, how many weeks?
Me 26 weeks, 5 days.
Wow.
And I'm now mostly no semi saying engine. Then the I call hospital doctors and I so we who have difficulty and I should rush to the hospital. Sometimes na ye juma obi wa ha ye juma sa na obre nti nyama bebre ekose ma eya na o time nso ya nkola ne ba nti mimi say no menya 26 weeks 5 days na me wo ye na mostly no nso menyima entenji no mo say aya awodie no say enye den a awodie na no ye mresa na o fa ye fun na say wan call hospital na ya check you on and off sana etumi ma akora no eba ntem nti mimi say no na ka wosan ka meko na ka ya chechire awodie na no but na me free so ebia eye normal tin na de ni see ye no first na ma ya se na ye me ya nti no me buy Friday na ye buy e buy nso anu mo se na omoji awo ni nkofo eba ha mo hwe ni papa nti me to me bo ni amuno na me fa o ya o but me tim enya nto baase ti ye ko twa scan buy na doctor no so se na aye no ma wode na no ebie dida nti there is nothing na ye beye na me see you nti no the best na me se meto me bo a akwara no be den obepie ye ntumi nya me see yes
omo ka cha say omo ntumi ye ho hwe ni ti so omo to omo bo asema akwara ne ba no na wo feel say na ye wo say
na me feel bad na me yem hwehwe me because my fire fu amana say da
okay
manya miscarriage da nti no
na time be na say
eno nso eno de menya 3 months na say nti no ye ba ya omo cancer no na me yem hwehwe me na e ha me say me hu ne ekoso wo me yem ade no so ye me ya nti na ma ye bata but me nim de me ye nti na wo say me tu me bo na me fa o ya oni mo na ne e beba no na yakopon aye
nti akwa ne ba abonten no omo de na kire o
oba ye no mo de na kire me
na ne size to say hu ne say
kit
like what don't start kire
kitwa oye kit say me nim say wo mo like sebi so when we say na jamo awoda jamo awo fresh a say na etie no sa pepepe na otie e na me hu ye sa time na me wo bad conditions me hu say omo de na eko until later on na omo be hwe me ye bibia wie ye na nsa na me nante baaye na me be hwe no
nti hu no na wo feel say
na me feel bad na me yem so hyehye me mostly na me yem hyehye me because say na otie a me hu no na me nim say no krani nyame nim de na me nim say obe free mo because ntina like I was not having hope na me ni hope bia but me hu nsa mo di na hye kubeta mu na mo ye na mti o we de say nyame di ma ba bedru ha die ebe yie most times no tama me be hwe no ye no ma be hwe ni bio
ntina wona o ma ne no fo ana say
me ma ne no fo o hye kubeta mu me ma ne no fo o hye mu saa nti no omo posti me free ha no ma me call postnatal no na me be hwe no ba me ba me run inside baby akubeta ne da any door na no me ba me hwe no through window no mo me hu no saa na inside o me run o me ben no because me feel bad and na na o ye kitikiti na o ye no me tumi so saa me hu no say na makọ me gina get na me hwe na makọ nti tama me start say me ben ne tama mo demanding for breast milk na enyama bi mu a o say me de tutu ne nchen say na ebe ya mo hia bibia ho no mu na me start say me ben kaka
motna niku emre do say
you can say me nya 2 months on niku ansa na me ku fie because of a kind of condition nti na o say nurses fo no etu omobo ehwe no na ade ba ko ade bia ya na managing say nurses fo no mo niku no they are very caring omo jade papa omo jade de wi omo no be kasa se na wo re kra ho no omo no be kasa na ebe ma wadwenjin kra be ba down Me ba NICU no omo ni ma kasa fine. The time bia no omo no kasa omo hwe nkora no ma ye fine. Ti NICU de me free ana manya 2 months.
Okay, into sa akwa no we dey say.
Sisi ana yenya 7 months a yekonya 8 months.
Okay. All right. Me that's it. Why? Asoma okay be share obi a ono so wo akra ketwa sa wa wo preterm no e be share ne nkwan mo no so nye inida so. Me that's it. Why?
To me that.
So let's go and continue our conversation with Nurse Mariama. That was Gloria's success story, and I know you've learned a lot from it. Mariama, this one is to your credit. It's to the credit of the whole hospital. What do you have to tell the mothers out there, the health professionals out there, and the general public about prematurity?
Thank you. To the family, premature babies thrive with good support, especially when they support the mothers. Mothers are able to nurse these babies well. They shouldn't leave or shouldn't have the impression that mother has done something and there's somebody somewhere doing them. It's happened spontaneous or based on mother's condition. That's why baby was born that way. And then when mothers are sick, they should encourage them to go to the hospital, see their doctors, and be able to identify what their challenges are and be able to help them go through their pregnancies successfully. And they should know that not all of us will be born at 10. Okay. All things being equal, we all want to give birth at 40 weeks.
Okay.
But if you're not able to get to 40 weeks, there are people, the trained health workers, who are able to go to school and have their work at heart, able to help them thrive. So the fact that you didn't get to 40 weeks doesn't mean when you give birth to a baby, your baby will not thrive. And to my colleagues, health workers, sometimes what we intend to say doesn't go down well to our patients. We should be a little bit more patient when babies like this are born in the hospital, especially at the NICU. Some mothers don't understand why they are supposed to come and feed babies 3 hourly. They're supposed to gown, they're supposed to wash their hands anytime they enter NICU. But with continuous effort, mothers will pick up and understand why we do what we do, just for the benefit of their babies. And to the general public, it is what they say that breaks mothers' hearts. Baby ben near Kolabe na wawo. Especially during CWC, you see preterm mothers come. They come and report at the NICU that they kindly want me to weigh their babies at the NICU instead of at CWC.
Can you explain CWC to us?
That's Child Welfare Clinic.
Good. Okay.
Most people say weighing when they go for weighing.
Good.
They come back to NICU. They want to expose their babies. But when you come to Shell Sudoku now, with CWC is individualized, so babies are not exposed for everybody to see. Okay. So now mothers, preterm mothers, are comfortable and able to weigh their babies well. So the general public, we should encourage such mothers. Right. It's not easy, it's very, very stressful. But there are comments that they make break this mother's heart and they don't come for weighing. When they don't come for weighing, we miss or we are not able to detect their problems. So they should allow such mothers, when they come, they shouldn't look at them weird. They should just be grateful they didn't give birth to a child who is preterm, but rather encourage such mothers. They need it.
I won't let you leave until you answer this question for me. It's very, very important. Okay. What's the role of a father to a preterm baby?
The father can also come and do, once in a while, come and do KMC, that is kangaroo mother care. They place the baby on their chest, and then we keep the baby warm to prevent hypothermia, so that the mothers can have enough rest. Giving birth to a preterm is very stressful. So the fathers can come during visiting hours and come and go through this whilst their wife have enough rest and have a chat with them whilst they are on admission.
Mariama, thank you so much for joining me on Healthline TV show.
Welcome, and thanks for having me too.
Hope to see you again.
Sure.
Viewers, thank you so much for watching Healthline TV show. This show was brought to you by Moose Condoms and Home Fresh. See you same time next week. This is Healthline TV show, and I'm Stella. Healthline, everything on health.
HealthLink was brought to you by Moods Condom and Home Fresh.